must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
Anybody who has been in the military will understand that when at war, in war, with war, you don't court-martial your soldiers or officers while the war is on. You finish the war first and then investigate the officers or soldiers who might have misbehaved or neglected duty. This is the doctrine of the institution of war. Today, Kenya is within the war and at war with an invisible enemy called COVID-19. And we must support the efforts of the frontline officials. Then we put them on trial later if there are mistakes. Remember, the country is at the weakest link now, and we cannot afford to deflect the efforts of those soldiers on the front line of fighting COVID-19. Thank you very much, viewers. That is me.
Remind you, and I quote, and this is the case we are seeing today, that whoever heeds discipline shows the way to life. But whoever ignores correction leads others astray. That is in the Bible, Proverbs 10-17. The reason I am quoting this verse, fellow Kenyans, is because the figures that we are hearing today are a clear demonstration that things are not getting better. And people who are telling others that things are better are lying to them. And somehow, somewhere along the line, we seem to have come to the conclusion, as a society, that things have gone back to normal. Today's figures show things are far, far from normal. Things are very challenging. And those who are exhibiting the indiscipline that I've referred to, leading others astray, are becoming a common phenomenon. You will remember that 2 weeks ago or so, His Excellency the President de-escalated measures to do with hotels and eateries. You have all seen for yourselves, the media, even people in the media have been calling me and telling me you can see the abuse that people are exhibiting in the eateries and in the hotels. We gave certain protocols, and clearly a lot of people are not following those protocols. Yet there are those who are assisting us. There are those who are observing these measures. There are young men and young women working back into those places who would otherwise be at home and whose livelihood is being threatened not by the government, but by those who misbehave and then cause action to be taken across the board and across everybody else. And for today, I am still saying that there is a chance, and I ask those responsible to please adhere to the rules. But there is only so far that we can go and so many pleases that we can make. So those of you who continue on this path of exploiting Kenyans, on this path of exposing Kenyans, you will bear the brunt of the law. And I want to add here that we will take action. You will face the law. So I am asking and appealing to you to make it unnecessary for our security forces to be so involved in observing hotels that then they are taken away from matters of much more importance. So I want to appeal to those who are not doing the social distancing, who are not doing the hand washing, who are not observing the basic hygiene that we have put in place, that it is as a result of such misbehavior that we are now upwards at 45. And we have been warned by those modeling for us within the Ministry of Health that unless we change, we will continue to see upwards of 50 people per day, and of course this will be correspondingly reflected in other areas of our lives. The fact of the matter is, where we are right now, you are either with Kenyans or you are against us. When you are against us is when you expose other Kenyans. You cannot be behaving totally normally and then looking at every other Kenyan trying so hard and expect that you are going to be applauded for your action. You cannot be in the middle and responsive to the call of time. Our destiny as a people is bound now in both collective and individual response to the pandemic. Previously, I have said that we will either rise together or fall together on this one. If you have been following the social media and the trends in the neighboring countries, then you will appreciate that sometimes we are victims of the measures that we have taken and victims of our little success. A chain, however, is as strong as its weakest link. When we allow our colleagues, relatives, and friends to abuse the containment measures that have been put in place, we weaken our collective chances against flattening the curve. By doing so, we make mockery of our 2 months' worth of effort to prevent this virus from outrunning our healthcare system. Ultimately, we are inviting death upon our loved ones and upon ourselves. But all is not lost. We are stronger and smarter than this. I believe it. We can stop this tide through our collective strong will, discipline, determination, and timely moves. Listen, we can do better. But when I say we, I am not referring to the government. I am referring to you and I. I am referring to your brother and your sister. I am referring to my mother. I am referring to my wife. I am referring to my children. These are the people who we are saying can do better. So whenever we say we can do better, please appreciate it's got nothing to do with the government. This got something to do with yourself. And as I've repeatedly said, if you assume that the person sitting next to you or the person standing next to you is possibly positive, then you will take action to stand further from them. I share the feelings that people have. I have been sent by people in anger who send me messages in anger, having observed people behaving in social partying, people sitting outside bars and drinking away, people sitting together even during this time of Ramadan, against advice by religious leaders, going out and you can see everybody crowding in together. This is not good for you, and it is not good for that person you are eating with. And it is not comfortable. It is not comfortable for leaders who have to keep on talking about this issue. And I appeal again and again to our political class to kindly focus seriously on educating our people and telling our people the ills and the challenges that as a nation we face.
My name is Sophie Mwanyumba from the Ministry of Health and working under National Public Health Labs. Today we are visiting the quarantine sites within Nairobi, and the teams are being dispatched out to go and visit the sites. We have the forms which we are going to use to capture the information of the visitors who came from in the country. And we also have the sample collection apparatus, which we have the oropharyngeal swabs and the nasal swabs. And each person is supposed to be taken the 2 samples, the nasal swab and the oropharyngeal swab. We have our PPEs to protect ourselves. We have the safety gears where we are having this, and the disinfection for disinfecting the apparatus which we are going to use. The waste, we have the biohazard bags where we are going to put all the waste which is generated within the site where we are collecting the specimen. We have the biohazard bags to safeguard the environment. And with us we have the transport media, because we have to make sure that the samples which we are going to carry, they are if the virus is there, they are viable. So we have the transport media which we are carrying with us, and we are maintaining the cold chain, because we have the cool box which is equipped with the ice packs to maintain the cold chain of the virus of the samples as we come back. To my fellow Kenyans, I have a word for you today. Kindly stay at home. I am at work to safeguard the environment and to safeguard ourselves. The corona is real. It is real with us. So please let us stay at home as the health workers continue working and supporting the government on the guidelines which they have been put on place.
Anybody who has been in the military will understand that when at war, in war, with war, you don't court-martial your soldiers or officers while the war is on. You finish the war first and then investigate the officers or soldiers who might have misbehaved or neglected duty. This is the doctrine of the institution of war. Today, Kenya is within the war and at war with an invisible enemy called COVID-19. And we must support the efforts of the frontline officials. Then we put them on trial later if there are mistakes. Remember, the country is at the weakest link now, and we cannot afford to deflect the efforts of those soldiers on the front line of fighting COVID-19. Thank you very much, viewers. That is me.
Peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
Mi naitwa Ivy Brenda Cheretich na niko 26 years old. So I was the first patient to be confirmed with COVID-19, which is hiyo ndio disease ni iko caused by coronavirus. So I came out to the Ministry of Health and I let them know that I was concerned because I had shown symptoms of COVID-19. Na hakuna mtu pressure like go forward. Ni mimi tu niliamua as a responsible Kenyan nifanye nione as in juni kazi yangu as a responsible Kenyan kukuja mbele na kuambia government I think this is what is happening and you might have to test me. Na niko happy because waliamua kunitake seriously, wakanitest and that's when wakapata niko positive. So after wakanipata niko positive walinipea treatment, walini support sana and niko very thankful to all of them for what they did. Kitu nataka kuwashow ni kuwa hii kitu ni manageable na ni treatable. If you think you have it, don't be afraid. Usiogope ati watu watasema nini or that ati watu watani stigmatize. Hiyo ni kitu tu, it's something that ni normal. It happens to anyone and unaweza contract. It doesn't matter, unaweza kwa young, you can contract it. You can also be a child and you can be an older person. Hii kitu ni ya anyone. It doesn't discriminate. I discriminate based on age, ati when, how many years, or gender, ama ethnicity. Hii kitu ni ya kila mtu, but because we are really trying to fight hii coronavirus, it's also part of your responsibility kama Mkenya ukwe responsible na ukuje out with your story. Because umeona mimi niko confident with my story, right? Sijaogopa anything. So that's what I would like to tell you guys now, because najua kuna patients sahi wana receive treatment and wanaweza kuwa a little overwhelmed. Najua it's normal, it happens to every patient. Nataka tu kuambia stay strong because the doctors wanajua what they are doing. Unaweza fikiria they don't know, but they know what they are doing. They're constantly wako talking on video conferences, on phones na experts from other parts of the world. Unafaa tu kuwa trust and be positive. And thank you to everyone mwenye ameni support through this journey, and also for the CS pia yamekuwa very supportive, and I would just like to tell anyone, stigmatize anyone, don't kabisa.
Anybody who has been in the military will understand that when at war, in war, with war, you don't court-martial your soldiers or officers while the war is on. You finish the war first and then investigate the officers or soldiers who might have misbehaved or neglected duty. This is the doctrine of the institution of war. Today, Kenya is within the war and at war with an invisible enemy called COVID-19. And we must support the efforts of the frontline officials. Then we put them on trial later if there are mistakes. Remember, the country is at the weakest link now, and we cannot afford to deflect the efforts of those soldiers on the front line of fighting COVID-19. Thank you very much, viewers. That is me. Good morning, Africa. Good morning, Africa. Wherever you are in the world, thank you very much watching us. This is Punchline Africa Television. I am David Matanga from the Political Command Center of Punchline Africa Television, broadcasting in Nairobi, miles away from Miriam, in the headquarters of Punchline Africa Television, Punchline Africa Group, of companies, including Punchline Television Limited and UK Limited and Punchline Radio, Punchline Africa UK Limited. Thank you very much, viewers, wherever you are. Thank you. Welcome to our Good Morning Show, Africa. Good Morning Africa, which Miriam conducts very ably. And today we shall steal that show and call it Our Opinion. Our opinion today will be based on, are we sliding back on the war against COVID in Kenya? This show, usually at 11, we dedicate it for Kenya. We stand up to see what is going on. But let Miriam bring us up to date on the figures of Kenya before we make our comments. Thank you very much. And then I'll make a comment. I'll do it, and then Miriam can ask questions.
Right.
Thank you very much, viewers. There you are.
Kenya today has confirmed cases of 535. 24 deaths have been confirmed in the country, and recoveries right now stand at 182. The rest of the African statistics, we shall read them on top of the hour when we shall be looking at other news making headlines across the continent. So Kenya right now, 535.
535 people got it. 24, is it?
Deaths.
24 dead, 182
recovered.
Yes, thank you very much. That is how things stand in Kenya as far as COVID-19 is concerned. Viewers, the government of the Republic of Kenya has made efforts. Fred. The government of the Republic of Kenya has made efforts, concerted guidelines, and put it out to the public of the Republic of Kenya and the citizens of Kenya. Looking at the trend of what is happening and the events that are shaping around the modeling and the sample modeling of, and a comparison with other states in the world, globally, Kenya has done very well. But there seems to be a culture of sliding back, a culture where people want to go back to their old habits. What destroys such an exercise? What brings it to a situation where people need to understand that it is not gone yet, it is here. The virus is here, is with us, is an invisible enemy. An invisible enemy for the people of Kenya to understand that they must help themselves, not help the government, but help themselves to fight the enemy. If we don't unite to fight the enemy, if we slide back to our habits, our behaviors, our eating pattern, our socializing pattern, our praying pattern, our stigma, fear, complacency, impunity. These are the things that are letting down Kenya and most of the parts of Africa. It is therefore my opinion and our opinion and the opinion of many other people who are at the forefront in fighting this disease, that the people of Kenya stand firm against the few individuals who are violating the regulations, the guidelines, the restrictions that the government has put in place. Your failure to agree or to abide by these regulations might force the government to take more drastic measures that we might not know because we are not part and parcel of the government. But as the media, we sound what the government has said. Failure to adhere to these principles and guidelines could increase the multiplication or multiply the disease reproduce the disease in the community. The cases of Isli, the cases of Mombasa, Majengo, where people still eat food in one common place as if they don't know what social distancing is. Such acts, barbaric acts, when you have been actually given the guidelines that this disease enjoys where there is company of being together, that this disease kills when you shake hands, that this disease kills when you cough without covering your arm, with the arm, that this disease can kill if you sit in a car with a person who is either a silent carrier, a passive carrier, or an active carrier. It is up to you, the people and the citizens of the country of Kenya, to adhere to Mutahi Kagwe, to listen to the Minister of Health. The cries are not very far. We know the situation might be difficult, and many people are talking of returning to work. I can see many cars in Nairobi streets, plenty of them coming back and the traffic jam building up, which is a sign that people have returned again to work. But is it the time to do so? It is up to you as a citizen. The legacy trend, therefore, myself and other people want to call upon you to resist, to deny these few people who break the curfew, who drink in estates, who break the restrictions, who ferry people, who sleep locked up in a house of about 50 people, who eat badly, who fail to wash hands, that there is no room for complacency, because virus COVID-19 does not choose whom to attack, does not tell you how to attack. It attacks you when you fail to listen to the instructions and the guidelines that the government of the Republic of Kenya has put in place. God bless Kenya.
Very well.
Thank you very much, viewers.
Yes.
Over to you, Miriam.
Very well said there, Doctor. And indeed, you've
Okay.
mentioned a couple of things that are very important in terms of the driving factors and the contributors to the spread of COVID-19 in Kenya and indeed across board. But for a few, incidences that we've seen, or some monitoring, even the Ministry of Health has been doing, Kenyans, you've mentioned something very important: complacency. Look at that. Yesterday, the police raided a bar and restaurant in Umoja, and over 100 people were sitting down enjoying the nyama choma and beer. And when CS Mutahi Kagwe was trying to explain how people hop from bar to bar, going to eat one sausage and 2 bottles of beer, and then they go to the next one, and then the next one, like that, and the dangers that comes. Kenya seems to be oblivious, but not just oblivious. They seems to be complacent and back to their old ways, not understanding such moves or such things that they do will actually curtail the fight against winning the war on COVID-19. And so you've mentioned something there very, very important. Kenyans are back to their old ways. They become very complacent. They think the numbers there are just for Italy and the US and the rest. I mean, only 24 people have died in the country, so what? So the bad attitude and I think some level ignorance and also impunity, people just doing things because who cares? As we saw on the front pages of the Star newspaper, and we mentioned it earlier, how an imam in Isli, which you know right now is a hot point center here in Nairobi in terms of the numbers that have come there, people who have tested positive for these cases, and to be precise, about 45 cases have come from Isli. And we see here an imam who already knew had tested positive for coronavirus. This imam knew of his status, but still went ahead and held meetings, still went ahead and gathered with people, still went ahead and acted on impunity. So complacency and impunity. And these are very driving factors. So maybe I just read a story of that on page 2. Very shortly, an imam with the coronavirus kept spreading it in Eastleigh, Nairobi, until he died last month. Look at that. The cleric who lived in the area had tested positive for COVID-19 and died on April 16th. He was buried the same day. Despite knowing his status, the imam continued praying in mosques and visiting different houses. Why are people still allowing people to go to their houses? And yet the government has said this is not the time for birthday parties. This is not the time for housewarming. This is not the time to go visit your loved ones. You can FaceTime, you can call each other, you can text each other, but for the sake of your own health and the health of the other person, please stay in your house, whether it's your brother, whether it's your sister, or an imam, or a priest, or whoever it is. They're not supposed to be coming to your house. So look at this level of impunity, doctor. Although right now the imam has died from COVID-19, but even after he had tested and knew his status, he still went ahead and continued to conduct prayers in the mosques, even against the government directive there. So this impunity and complacency, I think the key driving factors, to the spread of the coronavirus in this country. And we've seen the matatu, the PSVs. Initially, the last maybe a month ago, they would sanitize, they would put water points in the matatu stages. Right now, they're not doing that. Whether you want the sanitizer or not, they don't care. Lucky for a few of Kenyans walk around with their sanitizers in their passes. I think that should be encouraged now, because we've seen these people who are expected to work with the government have become very complacent, and they're thinking, come on, Corona will just go. They don't understand that now Kenya is recording higher numbers than seen before because of these kinds of attitudes. And as you mentioned there earlier, complacency and also impunity, and to some degree, some level of ignorance.
It is true. It's not level. We need more civic education. Today I've written an article to that effect. Civic education. Do we have enough sensitizing our people to remove stigma, to remove fear? People fear to go for mass testing. Mass testing is working in Britain, because in Britain, everybody has got NHIS number. When people wanted to get Uduma number here, people were even telling people never to get it. But now you see the importance of Uduma number, because the government will know if it is mass testing. People will know who has not come. If you go to Britain at the moment, they will know why house number X has not arrived. Where the samples? What happened to the sample? Someone will come by your house, your outreach worker or community worker or health worker will come and say, what happened to the result? We gave you the testing kit. You didn't bring it back. And then you will have to explain. And then if it becomes, you break the law and the Health Act. So it is very important today to make sure that the message sinks home. This disease does not select whom it wants to take. This disease is always part and parcel of the air that we breathe. You walk through the town now, cars have returned. Car parks are full. People are wearing masks halfway down here. Anatembea too. And there is even greeting people. So we must activate. The radio, television systems, media in Kenya should be printing these things for a week. Headlines, we don't want to see the headlines. Let's see only something that touches Corona. So that people can explain, those who can explain, let it be like a BBI. It was put in for people to read. Let's get this translated into, create apps. Let the government create apps and send them. But the worst part of the enemy of the people of Kenya is mindset.
Exactly, mindset, and our attitude towards how we have been responding to anything the government says. And as much as maybe sometimes back with the government, when it puts out some measures, we thought that has nothing to do with me. So Kenyans have had that aloofness and that lack of cooperation for whatever reason when it comes to whatever government is saying. But on this one, it has nothing to do with the government. It has nothing to do with the police. You don't have to see the police for you to wear. When you see even these matatu drivers and conductors in the morning, when I come to work, you see them in their matatus. And when they see a police block ahead, that is when somebody will adjust their mask. I don't even understand. You're not doing that for the police. You're not doing that for the government. You're not doing that for you not to get in trouble. You're doing that to protect yourself, to protect your health, to protect your loved ones, so you will go back to and see later on back in your house. You're protecting them when you're doing the right thing by wearing your masks and washing your hands and ensuring that you sanitize when you're unable to wash your hands. And so you're not doing it. It's just the mindset, doctor, which is I think getting us into more trouble because if you have a mask under your neck, under your chin, you and the person who hasn't bought one, same difference, you're all exposed. And then when you realize there's a police roadblock ahead, that's when you adjust and you wear it properly. You're not wearing it for the police officer. And these are just some of the bad mindsets and attitudes that Kenyans really need to change, especially when it comes to this fight against coronavirus. Those people who were caught yesterday by the police, doctor, you were watching, I'm sure you watched the news yesterday from Umoja Estate. They were seated at a restaurant, and they were enjoying nyama choma, they were enjoying all these foods, and they sat as if everything is okay. And on Tuesday, the Health CS Mutahi Kagwe on Tuesday said that the decision to reopen the restaurants as an intervention to secure some form of livelihoods has been abused. So what Mutahi Kagwe said, and even last week what President Uhuru Kenyatta said, yes, some businesses, especially the restaurants, will be open, but not yet, because there are measures, a raft of measures that the government had put in place, which is all your staff must go through mandatory, testing of COVID-19 to ensure that they're okay, even as they prepare to come and serve Kenyans. Number two, your establishment must observe the certain level of social distancing, and the Ministry of Health officials must come there and ascertain indeed this restaurant can actually observe social distancing. But immediately, the government said this, we saw some restaurants now opening even without this meeting these stipulations that the government had put in place. So Mutahi Kagwe came out and said, they're already starting to abuse this. They've not waited for the Ministry of Health to come and ascertain indeed that the establishment can have a social distancing. Does it have enough space for social distancing? Are the people who are going to serve Kenyans there, have they been tested? Are they okay? Are they healthy? They have not observed any of this. So they're already abusing this leeway that the government gave, a lifeline that the government gave to some more businesses in this country to ensure that they don't completely get affected, but they start coming up slowly. But now if they're not cooperating with what the government is saying, if the government decides now let's all shut the restaurants back again, they'll start complaining, and that is where the disconnect. Why is it so difficult for Kenyans to just do the right thing? Some Kenyans to just do the right thing.
I think it's not only Kenya, but it is a general trend across Africa. And most Africans tend to neglect or ignore what the government tells them. It's not only Kenya, but the Kenya. What kills it is impunity. That even people know that the one selling meat is breaking the law, but is encouraged by saying, put more 2 goats. So, I mean, we have a problem here in Africa. Let's admit it, that there is something that is not tying up. And my opinion is, if we go the way we are going, the only way out left for President Uhuru Kenyatta is to seek Article 132 of the Constitution of Republic of Kenya, which is very clear, 132 4D, which says the president can now go and ask the parliament to give him permission to put a state of emergency, which will remove powers from normal civil operations to a war-like operations. Why do we want to go that route? We want to preserve the economy. The measure that the government put in place can best work on the economy of Kenya, that post-coronavirus COVID-19 era, when it is when it is finished, it will be a nice stepping stone with the economy still there, floating. Then we can cross the bridge and hand on something else that you can see across there. But other than that, we have a very big problem if we don't observe the rules. Because you see, reproduction from the community is different from reproduction from the airports, the planes. These ones, we could see them, but in the community, you can't see them. Like that imam who was actually teaching people. These children are being taught in schools. You can see this type of feeding, see this type of movement in the town. This trading, this is Isli. This is Isli market where people are trading. Surely something must happen to change this course of events. Miriam, less than that, I don't think we are in a proper mood.
And also something here that is also very disturbing, Doctor, on page 4 of the Standard newspaper, if you can, they're saying chaos after youths eject medics from Mombasa Old Town. Diagnostic testing for residents of Old Town Mombasa has been suspended after angry youths ejected a team of medical officials and threatened to burn down an ambulance. Trouble started at around 4 p.m. on Monday when rowdy youths armed with crude weapons barricaded the town's narrow streets, accusing the county government of trying to disrupt prayers during Ramadan. The medical teams fled and now demanding police escort before venturing back to Old Town, because Mombasa Old Town has been noted that it's one of the places that has recorded a substantial number of coronavirus cases. And so we've seen Governor Joho time and time again expressing his frustration, and also Ministry of Health expressing its concern about the spread of coronavirus in that area. So mandatory testing has been set up there, and also a place like Isli and Kawangware, and free testing for that matter. And the government has been encouraging the people to go, and they took the medical officials there for the free testing. And now we see that the local youth there are now attacking. They're now attacking the medical officials. Doctor, I don't know what you would say to that.
First of all, that constituency is a constituency headed by an MP who is notoriously known as Jicho Pev. And it is him who went on national television and addressed Kenyans and said, there is no COVID-19. You heard his speech very clearly. Inasema people are being harassed, but he did not give alternatives of harassment. If you are choosing a government of harassing people, give an alternative of not harassment. But you can't just blanketly choose and run away. So he has caused that state of despondency in that area. That's why you see people there want to kill ambulance people, they want to kill soldiers, they want to kill the police. It is him. And it is him. He has brought in politics. And the politics of childhood, childish, very childish politics. And that politics of childhood, of childish adolescence, delinquency, of that highest nature, can bring about a lot of difficulties for this country. So this is not a simple thing. This is a very serious disease that is killing, that killed people who are at the hospital since Roman Empire of Julius Caesar, almost perishing. Some of the hospitals have been there during the Roman Empire, and they are still there. But now look at what Italy came to. It almost came to, the whole country came to stand.
To a halt.
So
yes,
it is a simple disease.
And we've seen these cases in Nairobi and elsewhere. We've not seen, even in Isili, the mass testing is happening. In Kawangware, it is happening. We've not seen anybody trying to attack medical officials. If anything, they're going there trying to ask questions, and they're curious, and others are just staying away. Nobody's going there to cause harm to the people who are conducting this very important service. I'm just curious to understand, why is it that Mombasa residents are reacting like this?
I mean, you can see the type of politics that has been planted there. Mm-hmm. That is one. The constituency in Mombasa that did not receive the votes or did not give Joe the votes is that constituency that is making the highest headlines. Two, the manners, behavior, habits, culture. People still think that eating food together is very good, and it will show that you are more godly than the others. Yet you are killing yourself. You can godly eat food from your house without going to join that rice eating competition, where you have to eat while watching the biggest meat. You are going to grab on the rice. So this is not very good. They should not do that. Mm-hmm. You can cook your food, pray to God, and you know, nicely, and go back, and then you know, break the fast and go home. But you see the type of life that is in Mombasa is not very good. It's regrettable, Miriam. I think I've done my bit this morning. I just want to hand over to you, unless there's something else.
No, just last, Doctor. Yes, and I'd like for you to. Do you have something else to take care of? But just one last question. Now, the state has threatened a total lockdown of the densely populated shanty town and barred residents from entering it to stem infections. Can a lockdown be enforced in such a situation, say like in Mombasa?
Yes. A lockdown can be enforced. Because when you lock them, they will cry to the neighbors. So the neighbors will report to them. Because no, you see, at the moment, people are thinking of this disease is like any other cough. They haven't seen it come closer. But when you see you have been locked down because there are people in the hospital collapsing, then you can understand everybody will take his isolation.
Okay. All right. Very well. Okay, so I think I'll also continue with some news here. I think for the parents out there who are worried about what will happen, of course, our education, all our schools, private, public, all have been closed down and were nearly 2 months now, and learners to spend more hours in school. According to the Ministry of Health, over 15 million Kenyan students will have to learn from longer hours and have their holiday time shortened once they resume learning, the Minister of Education said yesterday. Education Cabinet Secretary George Magoha said they will shorten the second term and reduce the August school holidays by 2 weeks and adjust school days to have longer hours so as to recover the time lost during the COVID-19 pandemic. So these are just some of the measures that the Ministry of Health is putting in place, even as we look forward towards resuming back normalcy in our education sector. So for the parents out there who have been wondering what will happen, a statement by Professor Magoha presented to the National Assembly's Committee on Education and Research said they had postponed school reopening to June 4th and resulting to a loss of 7 weeks of learning. So initially, the government had announced that it will open in May, but because of what we are experiencing right now and the challenge that we have due to coronavirus, it's not possible. And so it has been postponed until June 4th. And should the government see any, reason again to postpone it later to a later date, then I'm sure we will be, told that in good time. But right now, the schools will reopen on 4th of June, and for the students to, recuperate the time that has been lost. The government is now saying that will be required to learn. The learning will go on for longer hours, and also the holidays will be shortened. And I think we will all agree to that. So we're just hoping that if we cooperate, if we work with the government, if we do our part in maintaining social distancing and hygiene, basically washing our hands, sanitizing, wearing our masks, then this curfew, these restrictions, this closure of schools and other important institutions might resume soon. But the longer we keep joking around, the longer we keep turning this into politics, the longer we keep wasting time arguing about what is right, what is not right, can we just follow these standard procedures? And then if we play our part in the reduction of the COVID-19, then we might see our schools open back. We might see other important institutions open back. We might see the restrictions, the travel restrictions in and out of these hotspot counties reopen. But as long as we keep being very complacent, we keep being very ignorant, and we keep being very not listening and hot-headed, then we might be here for a long haul. So the schools are projected to open on June 4th. So we're hoping that by then everything, will be back to manageable levels in terms of the spread of the coronavirus. So that story is on page 5 of the Standard newspaper. And when you look at, the front pages there, the man who loved Kiroche Heres, I think this is a story that has been making a lot of headlines. And in an inclusive interview, Omari Lali Omar, who finds himself at the center of a probe into Tekra Karanja's death, opens up on how a chance meeting transformed into a 10-month love roller coaster. The stories on page 2 and 3 of the Standard newspaper. And just on top of that, the Standard newspaper, the headlines there revealed the deadly chain of transmissions. They're saying more cases. A government announces 45 new infections, mostly in Nairobi Eastleigh. We lift the lead on how COVID-19 has been spreading within our communities. Perhaps that is something that I should give a bit of attention, so that we understand, even as we fight the spread of this COVID-19. And I'll just read a bit of that. And Kenyans should get ready for tougher measures as government enforces measures to contain the coronavirus. Health Cabinet Secretary Mutahi Kagwe yesterday announced 45 new cases of the COVID-19, the highest tally in a day for Kenya so far, as the spotlight remained on Nairobi's Eastleigh, where 29 of the new cases were reported. And Kenya's total confirmed cases right now is at 535, out of which 63 are from Eastleigh area. And there has been cases in Wajir where were linked to recent travels by residents to Mogadishu, Somalia. And we've seen Somalia's cases have really spiked. And where is the story? They're saying, I think it's a feature story that, yes, on page 6 here. And they're saying you could be the weakest link in the fight against the novel coronavirus if you fail to maintain proven social distancing rules and regulations. You could spread the disease to your parents, child, spouse, house help, putting in place a chain of infections that might be impossible to stop. Now, a government document seen by the Standard shows just how quickly the virus spreads, linking different pockets of infection in Nairobi, Kilifi, and Mombasa to single sources. Among those at high risk of contracting and transmitting the disease are healthcare workers, individuals working within the healthcare ecosystem, such as security guards, as well as the blue-collar employees like drivers and house helps, whose job entails crossing from one side of the country to another on a daily basis. And now, the transmission chain study from the Ministry of Health shows how, for instance, a single exposure can lead to an almost unstoppable transmission chain that can reach as many as 37 people, each of whom start their own transmission chains wherever they are. This informs the recent jump in the number of positive cases of the highly contagious disease. Now, in case you're wondering why these numbers are spiking in Kenya, you can see now out of one person, we can get so many of other infections from just this one single contact, because they get in contact with other people, and these other people get into contact with everybody else, and the chain continues. And that's why it is important to observe social distancing. One of the ways that has been proven to be very, very effective in terms of the fight and the spread of the coronavirus, social distancing, social distancing, social distancing. If somebody's trying to come close to you, you don't even know them, in a public space, please politely tell them to move back over there and just, so social distancing is very important. And on top of that, wear your masks. Make sure that you're leaving your house, wear your masks. And when you're out there, if you can walk with a sanitizer in your pocket, in your handbag, that is the best and most effective way if you're entering a place or you're touching money and there's no water to wash your hands. So if you can get yourself a bottle, there are those ones you can even pocket, very small, like the one I usually have in my handbag, very tiny. You can have it in your pocket, and so anytime you touch money, you pay for your fare, you pay for your groceries, but you're encouraged to use paperless transactions or money mobile money payments or money transfer. But if you cannot, if you have to touch money, then ensure every time you touch that money you sanitize your hand, because you don't know how many people that money have circulated, how many hands, and just in case somebody touched it and they're infected, then you're able to get infected and then you'll pass it on to the next person. So it's very important. And some of these very simple and yet very important measures are very effective, and we've seen them being flaunted. As we mentioned there in the earlier show, when the government announced these measures, I would see even in the PSV sector, the public service vehicle sector, you would see they would have their sanitizers, they would have places where people would wash their hands. But right now, when you walk through Nairobi or you go through these bus stops, they don't care anymore. Their attitudes have changed. They've become very complacent. They don't care really. So if you want to touch or not, and the other day I went to a supermarket in the CBD there. I won't say which one, but usually it's a very busy supermarket because of its location and people. It's very easy for people to. It's accessible to a lot of people basically. So you'd see they have the sanitizer. Yes, somewhere mounted on the entrance, near the entrance when you enter the supermarket. It's automatic, so people are required to just go there, place your hand, you have it, and then you get your trolley, go in and shop. But you see, there's nobody there to enforce it, and where it has been placed, it's just upon the wall. So unless you're a regular visitor in the supermarket, you won't even notice it is there. And worst of all is the people they have put on the front there, the security or the person who's supposed to be responsible to showing the customers they should sanitize before they get in. They're not even doing that job, so nobody cares. You can just walk in, go shop and all that. So they've put another person there to take your temperatures. Come on now, we've seen people who don't even have the headache, don't even have the fever. So taking the temperature, you're doing zero sum work there. A person could be having just a normal fever for a normal flu, or they have malaria, or they have other illnesses. So a temperature, a high body temperature, is not as much as it is one of the symptoms for the people who are suffering from coronavirus, but is not a solution. It is not you're doing nothing if you cannot encourage people to sanitize before they get into the store, if you cannot encourage people to ensure social distancing. So what you're doing is zero sum, and you're not doing the fight against coronavirus on your part is indeed very weak. So I think these public service institutions should be very keen, especially when they're offering these services. And as I said earlier in our morning show, I went to a very one of the leading banks in this country a couple of days ago, and I was shocked to learn that they don't even have the sanitizers. I don't expect them to have water hand washing points. It's in a bank, but for heaven's sakes, can they put sanitizers? Because people are coming there to bank money. People are coming there, they're touching money. As long as you're going to the bank, you're either taking money or you're going to draw money from the counter or whatever it is, or to make some payments, school fees through the bank, but you're touching money, bottom line. That's why you're seated in a bank. And I would see a lot of people, the social distancing where they've put the seats there is not socially distanced properly, and also on top of that there are no sanitizers. And so I almost walked to the manager's office and asked, okay, so what is going on? You guys, you're doing this country a disservice in the war against coronavirus. How do you know how money can be a real driving factors when it comes to when it comes to the spread of the coronavirus? You should be doing your part in ensuring that your customers here are protected in terms of providing them with the sanitizers when they're coming in, and then after the transaction and they're leaving the banking hall, can you sanitize them again and have them leave? So I think that is something now the banks, can you play your part? you are the institutions that keep our money. So you have the money, please. You can afford sanitizers, a bottle a month or a bottle a week. It is not that expensive. You can afford it, so that you play your part in ensuring that the spread of the COVID-19 is curtailed. Otherwise, I was very, very disappointed as a Kenyan, and I hope that the government can start enforcing and identifying also that the banks can be a weak link in terms of the spread of the coronavirus, because these monies that we take there and we go draw from there, they have gone around so many hands. We don't know. They are not sanitized. We are not sure. So the best way is to ensure that we sanitize when we're getting into the banking hall, and then after we're done with the transactions, whatever it is we went to do, and we're leaving, we also sanitize. I did not see that happen. I did not see anybody trying to enforce anything. I did not see any temperatures being taken, which I think really is not really effective as that. The temperatures alone, I think sanitizers will go a long way in offering and ensuring at least a level of protection to the customers who are walking in and out of this bank. So we've seen here from that chain how the coronavirus has been able to spread in the hotspots in Nairobi, in Mombasa, and the residents there in Mombasa. I've been seeing even the older people there coming out, and I think they're still in denial. They don't understand the magnitude of the coronavirus. They're just going about their lives as if everything is normal. And Mutahi Kagwe keeps telling us, if we keep acting normal, this disease will treat us very abnormally. This thing is for real. So this thing, immediately we start arguing, immediately we start bringing our religion into it, we start bringing our cultural practices into it. Coronavirus does not care. You're going to get it. You get exposed to it, you will get it. You become careless around how you social distance and how you maintain your hygiene, you will get coronavirus. And that is the bottom line. Has nothing to do with religion, has nothing to do with our cultural practices. And nobody's trying to infringe on that. So every time I see the residents there in Mombasa coming out, they're complaining, they're making it very... politics has nothing to do with religion, but they would love to bring a religion into it. You're defeating the whole effort that the government has been making, especially the county government of Mombasa there. So can you just pay attention to what you're being advised to do? Stop. I know it's a special time, especially for the Muslims, brothers and sisters. And, in Mombasa, being at the coast, we have a lot of Muslim faithfuls over there. And this is a very important month in the Muslim religion there, Ramadan month. And so you love, when you're breaking your fast in the evening, you want to come together and just enjoy a good meal, which is good. But this is not the time. If the person is not from your own household, please let them not come, to your place. This is not the time for visits. This is not the time to have any social events. People, please, let's just do this for the sake of reopening our economy very soon, and for the sake of us gaining back our normalcy. But if you continue working and operating as we have been, the shutdowns, the lockdowns, the curfews might continue as long as the government seems necessary, and then we will continue to get very affected. This has been my opinion. Dr. Matanga got busy with something here to take care of. I'll take a very short break. Emmanuel Maluel, Dominic Nwandu, and also Bismarck Bura, Lisinganga, thank you so much. You said you're watching from Egypt. I'll meet you on the other side of the break, where we shall be talking all things Africa. I have a lot of news for us today. World Health Organization is still warning us about using the COVID organic from Madagascar. AU is now saying it will be paying attention to this wonderful herbal remedy from Madagascar. So I don't know if they'll be supporting it or not, but just keep it here, and then we shall look at that. And also in Burundi, people are dying. They're still campaigning over elections. You would think right now no campaigns should be happening. And also in the Democratic Republic of Congo, we have so much. And in Nigeria, in Biafra, we have the latest. In Ambazonia, in South Sudan, in Sudan, we have so much to talk about. So or diaspora dispatches will be coming to you on the other side of the break. Thank you so much for watching. I think it's about a minute to noon here in Nairobi. I guess it's still good morning. So good morning to you.
peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.